This video is just to highlight and provide a overview of the paramedic program of Pierpont Community and Technical College. The overall goal of the program in compliance with accreditation standards is to essentially create entry-level paramedics that are evaluated on the knowledge, psychomotor, and affective domains. That means that you've got the smarts, the skills, and the attitude to be a paramedic. And that's with or without extra points at the other levels of certification, such as advanced EMT, EMT, and or EMR. The program is accredited, as I mentioned, by the Higher Learning Commission. That is the overall accreditation of the institution as a whole. Specifically, the program is accredited by the Commission on Accreditation of Allied Health Education Programs, CAHEP. That's also endorsed by the recommendation by COAMS, which is the Committee on Accreditation of Educational Programs for EMS Professions. Without those accreditations, that means that a program cannot allow the students to take the National Registry exam. So what's the difference between the certification levels that you can obtain? EMT is the entry-level certification for working in EMS. That is what's considered basic life support. Being able to do basic airway management, a little bit of medication administration, CPR, patient assessments, bleeding control, very basic things. It is an extremely high demand, but that is the certification you get to get your foot in the door of an EMS career per se. Then there is the advanced EMT. That is a limited advanced life support role where it can do some of the skills and interventions such as a paramedic can do, but not all of them. It's truly about a midway between EMT and paramedic. It's kind of a newer concept and a newer certification, so not as much demand for it, but still demand there. And then ultimately is paramedic. That is the highest level of a pre-hospital provider. That is true advanced life support. These are the providers that are starting IVs, giving medications, doing EKGs, intubating patients, managing airways, some really advanced things that a paramedic can do. Extremely high demand for paramedics. There is a national shortage on paramedics, so there's an immense demand to become a paramedic. The way that the program works on the educational side is we run what's called a flipped classroom. So essentially, you don't have to come to class to receive lectures and whatnot. All that is delivered in an online format. So all that intro stuff, the tip of the iceberg, as I say, is things that you're going to do on your own time. So when you come into class, we're diving deeper into the topics, doing all the hands-on components, scenario simulation, and all the detailed stuff. So the way that flow goes, before you come to class, you're reading through the books, you're studying some materials, you're watching the online lectures and presentations, doing some case studies, digging and starting into the curriculum. Then when you come to class, we apply all of that. So in that higher learning domain through simulation, in-depth group work, some more group discussions. But when you come into class, it's not a sit in your desk for hours and watch PowerPoint presentations. Then after the class, you're evaluated using exams and various other assessments to see how well you apply it all. So before class, you kind of prepare, engage in stuff on your own. You kind of got your brain warmed up. You come into class, we apply it, let you see how it actually really goes, discuss it more in depth. And then after the class, you're evaluated based on examinations. For the EMT class, that is just 1 day per week. That class is offered every semester, spring, summer, fall terms, and is only 1 semester long. So you can become certified as an EMT by coming to class 1 time a week. The rest of the work is done online, and after 1 semester, you have the opportunity to become certified as an EMT. Then you can advance on to the advanced EMT. So pretty much you begin in the paramedic cohort, which is 3 semesters. The first 2 semesters covers all the advanced EMT material. So at the end of that second semester, you have the opportunity to test for advanced EMT to gain an extra set of skills, an additional scope of practice within the field, providing higher levels of care to the patient while you're finishing the paramedic program. So within that paramedic cohort, that too is 1 day per week. So as it stands right now, that is classes on Fridays from 9 a.m. to 6 p.m. or Wednesdays 1 p.m. to 10 p.m. So you just don't pick each week which one you want to. You sign up and register for whichever cohort, whether you want to be a Friday student or a Wednesday student. Traditionally, that Wednesday class used to be 2 evenings instead of 1 long evening. So it used to be Monday and Wednesdays 6 to 10 p.m. rather than just Wednesdays 1 p.m. to 10 p.m. But surveying all the students, this is requested of 1 day a week seems to work out the best for all the students, which the majority of the students are all full-time students. They're working adults with families and other priorities outside of class, so everything here is catered for the working adult. But for that paramedic cohort, the only prerequisite before that is to obtain the EMT certification before the first day of class. That paramedic cohort begins every January. So EMT is offered every semester, but paramedic begins every January. So you can essentially become a paramedic in 3 semesters. Okay, the little asterisk there, and that's based on if you're already coming in with the prerequisite of an EMT basic. So that paramedic cohort is 3 semesters: spring, summer, and fall. So fall and spring semesters, each of those are 15 weeks of class. So it might be 16 calendar weeks with a Thanksgiving break and a spring break, but class is 15 weeks. Summer is 10 weeks long. So that summer term a little bit shorter. So if you're taking EMT during the summer, the class is even a little bit faster. Now, for the EMT and paramedic, there is classroom components, and then there is also a practicum component. In the EMT class, you'll spend approximately 24 hours doing ride time on an ambulance. In the paramedic program, you're going to spend approximately 416 hours in the practicum setting. You can see in this little graph here how everything is broke down by semester of where you're going to spend your practicum hours. You spend a significant amount of time at the hospital in the emergency department, and also a significant amount of time in the field riding on an ambulance. And then there's also other rotations at ICU settings, operating rooms, pediatric clinics, labor and delivery, and so on. So here's one example of the program schedule. This is a model that shows the EMMS 1103, which is the EMT basic class. This would be taken during the summer with one of the electives, preferably the emergency vehicle driving class. So after that 1 10-week semester, you can obtain your EMT and your certification to be allowed to drive an ambulance. Then you could begin in the fall. You could already be certified as an EMT, working in the field, and doing some more of your electives and general education classes as you see here. So intro to EMS, an EMS operations class, another elective class, and then the general education of English, computer concepts, and math. Okay, now everything that's in that box that's in red has to be taken in that sequence. So there's no deviation from those terms. So in the spring, that would be the paramedic cohort, and all 6 of those classes must be taken together. Same thing into the summer. Those 4 classes are required. So in that spring, you must pass all of those classes to be able to continue on in the summer, and so on. That continues into fall. But you must pass all those summer classes to be able to do all those EMS classes in the fall. Now in that fall semester, you can see the English and sociology and psychology. Those only prerequisites are classes before that. So that second English, you must have had a first English before you begin on that. But the big thing to look at there is all those EMS classes must be taken together, and all of those that are in red have a prerequisite of an EMT basic certification. Another example is if you were to begin in the fall semester, you would begin taking the EMT basic class as well as some electives in gen ed classes such as the Intro to EMS, EMS operations, written English, which is an English 1, and the emergency vehicle driving class elective. Then you can see in the box in all red are all of those paramedic cohort classes taken together in sequence. Then once you're done with the paramedic, then you could finish up the general education classes in your final semester. So those first two models were for the associate's degree. We also offer the certificate of applied science, which you can see here in the model schedule. This is only EMS classes. That would be it. You wouldn't have to take any general education classes to become a paramedic in this model. So the only difference between the associate and certificate of applied science is that you're getting a higher degree, kind of puts you up a little bit of a leg, but still, ultimately at the end, you must have all those EMS classes to be eligible to certify as a paramedic. The only difference being is whether you take the general education classes for the associate's degree or not. So in this model, you can potentially begin in the fall, taking the EMT basic, the EMS electives, and EMS general courses, and then going right into that paramedic cohort, and then certifying after that fall semester as a paramedic. So you can see here, if you came in and only wanted to become a paramedic, just wanted a certificate of applied science and not the associate's degree, you could do so in just 4 semesters. One of the biggest questions I get is of the cost. This is a full-time college program, so it's based on tuition. Tuition is $212 per credit hour, 12 credit hours being full-time. So for that fall or spring semesters are your most expensive semesters, and that would be $2,544 per semester. And then program fees, course fees are additional on top of that, and those can fluctuate year to year just depending on, and semester to semester, depending on what supplies and other things are built into the program per term. Then summer is a little bit cheaper, being you're based on 6 credit hours. But one thing that is awesome is there is the West Virginia Invest Grant. Basically what that means is you apply for your federal student aid, you fill out your FAFSA. We'll see what kind of federal grants or scholarships you may be eligible for. The West Virginia Invest Grant could kick in the tail end to help cover your tuition. So that essentially can mean that you're basically going to school for free, that will pay for your tuition, but there are some minor stipulations into that and some other institutional fees that West Virginia Invest Grant would not cover, as covering your tuition. And there's some other stipulations to that which you can find out more from the West Virginia Invest Grant website. If you have any questions on those matters, you need to contact the financial aid office. So to be admitted into the program, first step would be to apply online at pierpont.edu. It's a series of questions to go through, just general admission requirements into the institution. Once that's done, if there's any transcripts that you have, those too must be submitted to the institution. Then once you are granted admission into the institution and you've declared yourself as an EMS major, then you're essentially into the program and you can begin the general education classes and EMT basic. But prior to beginning that paramedic cohort, there's an orientation system that you must go through. That's just a little bit of coursework, some program requirements for the hospital side and for clinicals that will be required during the program. And then before that cohort, again, that EMT basic certification is required. As an overview for an EMS career, an EMS, for those who complete the program and pass their certifications, there is a 100% job placement. 100% of our graduates who successfully pass their certification are readily employed at EMS agencies. Again, there's a super high demand for EMS providers, so these employers are scrounging trying to find employees. So just work hard, pass your certification, and a job awaits you. Your certification is a national credential through the National Registry. So that means once you have that National Registry, you can go and have that credential and take that to any state that you would like to go to. Now each state certify you, so once you have that National Registry credential, you can take that to any state, and then they may have some small details they need you to work through, maybe some updated education, and then certify you per that state. Because each state operates EMS just a little bit differently with different protocols, different scopes of practice, and whatnot. The EMS career as a whole is growing 6% annually, which is faster than the average job according to the Bureau of Labor Statistics. Also, according to that same source, it cites entry-level paramedic salary to be $39,000 nationwide. Now, different agencies will pay different amounts, so larger agencies can sometimes pay more. So at different agencies, the salary is going to change just depending on how those places are set up, of course, as is with any essential business. Those employment opportunities can assist for ambulance services, which do just EMS, whether that's a municipality, a county, a private agency. There are agencies that only do convalescent transports. There are agencies that only do 911 response, and agencies that do a combination thereof. There's also employment opportunities at fire departments. A lot of fire departments house ambulances, especially nationwide. There's also fire departments that just staff paramedics without ambulances. And then there's also the affordability to work in the hospital setting. Hospitals are more and more hiring up paramedics to work as technicians in various capacities throughout the hospital, especially at the EMT level. A lot of former students go on to work in the hospital setting as various technicians. Then ultimately it seems like it's everybody's dream goal is to work at Air Medical to be a flight paramedic, which that requires additional training and some years experience as a paramedic. If you have any additional questions or there's anything else you'd like to discuss, please feel free to contact me. You can see my email listed there. That is by far the easiest way to reach me, or via my office number 304-367-4501. But again, email is the easiest, btacey@pierpont.edu.